The next generation Nclex is a comprehensive examination designed to assess the knowledge and skills of nursing students. The case study question is an integral part of the Nclex, as it provides a real-world scenario that the student must analyze and apply their nursing knowledge to in order to come up with an appropriate solution. These case study questions are designed to challenge the student's critical thinking, problem-solving, and decision-making skills, and will play a major role in determining their readiness for practice as a nurse. Let's take example. In the current case study, we will cover 6 questions based on the case study given. Please do not forget to go through nurse's notes, physician's order, or lab values while going through these questions. Patient's history. Mr. John, a 65-year-old male, was admitted to the hospital with complaints of confusion, muscle weakness, and seizures. His past medical history was significant for high blood pressure and diabetes. He was on diuretic medications for the past few months. On examination, his blood pressure was found to be low and his pulse was weak. Nurse's note states that at Jan 31, admitted with complaints of confusion, muscle weakness, and seizures. BP is 90/60th Nc, pulse, weak mmHg, hypertension, diabetes mellitus, and is on diuretic medicine in Feb 1. The sodium level is 125 milliequivalent per liter. Started on sodium chloride IV infusions. Potassium level is 3.2 milliequivalent per liter. Physician's order reads the following. Sodium chloride IV infusion. Monitor electrolyte levels. Reduce dose of diuretic medication. Dietary restriction of sodium. Lab values of sodium and potassium for the patient are also given over here. First question on case study. What is the most likely cause of the patient's confusion, muscle weakness, and seizures? A. Hypertension. B. Diabetes mellitus. C. Hyponatremia. D. Hypokalemia. E. Diuretic medication. The correct options are C. Hyponatremia and D. Hypokalemia. Hyponatremia is noted in the patient's lab values 125 milliequivalent per liter. Symptoms of hyponatremia include confusion, muscle weakness, and seizures, which are also present in the patient. Hypokalemia is also noted in the patient's lab values 3.2 milliequivalent per liter and can cause similar symptoms. Hypertension and diabetes are present in the patient's past medical history, but are not the immediate cause of the symptoms. The diuretic medication the patient was on may have contributed to the low electrolyte levels, which is why the physician ordered to reduce the dose of the medication and monitor electrolyte levels. However, the main cause is the low sodium and potassium levels. What is the most likely cause of the patient's hyponatremia and hypokalemia? A. Excessive fluid intake. B. Increased use of diuretics. C. Kidney disease. D. Medication side effect. Answer is B, or increased use of diuretics. Let us see what could be the explanation. The patient is admitted with symptoms of confusion, muscle weakness, and seizures and has a low blood pressure and weak pulse. The patient has a history of hypertension and diabetes and is on diuretic medication. The sodium level is low, 125 milliequivalent per liter, and the potassium level is also low, 3.2 milliequivalent per liter. The physician has ordered a reduction in the dose of diuretic medication and a dietary restriction of sodium. These factors suggest that the increased use of diuretics is the most likely cause of the patient's hyponatremia and hypokalemia. Option A, excessive fluid intake, is not likely since the patient has a low blood pressure and is being monitored for electrolyte levels. Option C, kidney disease, may also contribute, but the focus is on reducing the dose of diuretics and dietary restrictions of sodium. Option D, medication side effect, is also a possibility, but the focus is on the patient's use of diuretics. Let's see another question based on same case study. What is the correct nursing intervention for the patient with hyponatremia and hypokalemia as noted in the scenario? A, stop sodium chloride IV infusion. B, increase dose of diuretic medication. C, no dietary restriction of sodium. D, monitor fluid intake and output. The correct option for this question is D, or monitor fluid intake and output. A, stopping the sodium chloride IV infusion would be detrimental to the patient as they are suffering from hyponatremia, which is a low level of sodium in the blood. Sodium chloride infusion is necessary to replenish the sodium levels. B, increasing the dose of diuretic medication would further lower the potassium levels as diuretics increase urine output and can result in the loss of potassium and other electrolytes. C, no dietary restriction of sodium would not be appropriate as the patient is already suffering from hyponatremia, which could be due to excessive sodium intake. The dietary restriction of sodium is necessary to regulate sodium levels. D, monitoring fluid intake and output is important to ensure that the patient is not retaining excess fluid and electrolytes. This will help to regulate the electrolyte levels and prevent further fluctuations. Another question. What is the nursing intervention for hyponatremia? A, provide sodium chloride IV infusions. B, provide osmotic diuretics. C, choose hormone replacement procedure. D, reduce the dose of diuretics. The correct option is A, or provide sodium chloride IV infusions. If hyponatremia is due to fluid or blood loss, vomiting, or diarrhea, the nursing intervention would be to provide sodium chloride IV infusions. Option B is not correct, as osmotic diuretics are used in case of excess fluid volume and not in case of hyponatremia. Option C is incorrect, as it is only applicable if the cause is Addison's disease. Option D is correct only if the cause of hyponatremia is due to certain medications, such as diuretics. Another question for this case study: what is the nursing intervention for hypokalemia? A. Provide sodium chloride IV infusions. B. Administer diuretics. C. Supplement dietary potassium sources. D. Reduce the dose of drugs causing hypokalemia. Correct option is C, or supplement dietary potassium sources. As an explanation, option A is incorrect, as hypokalemia is not caused by fluid or blood loss and does not require sodium chloride IV infusions. Option B is incorrect, as the use of diuretics may further deplete potassium levels. Option D is incorrect, as reducing the dose of drugs causing hypokalemia may not be enough to treat the condition and may require additional interventions. Option C is correct, as supplementing dietary potassium sources, such as bananas, spinach, or other green leafy vegetables, can help to raise potassium levels in cases of moderately low potassium levels. However, severe hypokalemic states may require supplemental potassium.